Electronic health records, very simply, are just an electronic format for a patient's paper chart. So instead of a patient going in and the doctor documents everything, history and all that in paper form, it's done electronically. Anybody that provides any kind of medical service or health care to patients needs electronic health records. That includes anything from an MD to a DO to a podiatrist to a psychologist. Anybody, a chiropractor, anybody that does any kind of health care has to use electronic health records. The government has given us this, effectively a mandate that all providers of health care in the United States use electronic health records rather than the paper format. There are some doctors who do a lot of menial tasks, calculations. They have to look up lab results. They have to find whatever tests or the things, examinations that they do sometimes require menial work by the physician. And electronic health records will help to automate some of those things so that the physician doesn't have to be using his time doing some of those menial things, but instead can care for the patient really. Human error can be greatly reduced by EHR because of the reduction in steps that a person has to take manually to do whatever it is they do, any aspect of seeing a patient and providing health care. I've worked as a practice administrator. For several years I administered a medical practice. And in doing that, I came to understand what the challenges, difficulties, and issues are that face a physician, that face an administrator, that face technicians, anybody that's a member of the office staff. I have a good feel for what those issues are and how to take care of those. At EHR Advisers, we've worked with practices through the EHR implementation process, and we understand what the issues are that they face and how to overcome the challenges that are presented. We've been involved with electronic health records. We are very familiar with government mandates, with the vendors that are out there and kind of the ways that they work. We've worked with practices and we know what things are important for them. And because of that, we have the knowledge, the expertise, and the understanding of EHR to make it a successful project for practices. The key is we do free consultations for the first time with any practice. We don't charge to come sit down with a practice and say, where are you in things? What do you feel about EHR? What are the issues that are at play with your practice? And let's look at how we could help you. We try and do that free for our clients so that they feel like we can get a good feel for whether this will be beneficial for them and for us.